other in the chat box or say hello as needed. And it's great to see you all here. Thank you for joining us. There is a lot going on in the world right now, and there's a lot of hard things going on and a lot of virtual places that people could be right now. And so we're really glad that you've chosen to be here with us today and dig into what's happening to transit and connect with each other in the ways that we can. So thank you for joining us. My name's Edie Irons. I'm the Communications Director at Transform. Our presenters today are Hayley Courier and Josh Stark, and Dave Severy is at the switches, supporting us all to connect and have a smooth event. And I'll introduce them more towards the end of my introduction, but just a quick rundown of what to expect. In the next hour, we'll hear some brief remarks from Hayley and Josh about what's happening in the transit world and in California, and particularly in the Bay Area. Hoping to spend less than 20 minutes on that so that we have plenty of time for questions and discussions. We'll have a few prompts in the chat during their remarks and kind of during that introductory time, and encourage you to participate that way. And then we can talk to each other and discuss all of this for the bulk of our time together. We are recording this this hour, and we may take a screenshot now and again for sharing. So if anybody is uncomfortable with their image or words being shared, please let us know. You can chat privately to me or Dave. You can also just turn off your video at any point if that does it for you, if that will address your concern. Everybody is automatically muted when you entered, and we might mute everyone during the kind of speaker portions, but you have the power to unmute yourselves, and we encourage you to do that as needed when we're in discussion time. You can also use the raise hand function that is there I think it's under participants, or it's under the blue kind of dot in your square, I believe. So you can raise your hand virtually to indicate you want to say something. You can also use the chat to draw attention to yourself, or you can wave your hand wildly or just unmute yourself. And again, we encourage folks to turn your videos on if and when you're comfortable doing that. The more, the better. It's just nice to see people's faces and to see your reactions and have the sense of being together. And the other recommendation to have that sense of being together is to turn on gallery view at the top right of your screen. It either says speaker view or gallery view. And if you want to switch from to gallery view, it'll show the kind of Hollywood squares, as many people as possible in the screen. And if more people join us, we can, in fact, it looks like we have 2 screens of people already. So you can toggle back and forth between screens. And if you're on a phone, you can just swipe to go to gallery view, and it'll show you 4 people at a time. So hopefully that'll help us feel connected. And I wanted to just make a quick ask. Dave is going to drop a PayPal link into the chat if you want to, if you're in a position to make a donation. This event series is the closest thing to an in-person event or fundraiser that we're likely to have this year. We've canceled our major fundraiser, and we wanted to make it free to ensure that anyone can participate in these conversations, and that's really the main point. But we hope you'll consider donating if you're able If that's a comfortable thing for you to do right now, you might consider donating what you spent on a Transform event or a happy hour or a benefit concert in the past, or what you might expect to spend on a casual fundraiser with us. And we're not soliciting any corporate or, government sponsors for this series, as we sometimes do for our big fundraisers. We're just asking individuals, and we're really only asking folks who are able to donate. Many of our, larger sponsors for events in the past have been transit agencies or shared mobility companies, or, even consulting firms that are struggling right now, facing budget cuts and layoffs. And so we have a goal to try to raise $5,000 in individual contributions throughout this series, which is going throughout the month of June. And I really appreciate any donations you're willing to give to support our work. With that, I will just introduce Hayley and Josh, and we'll get started. Hayley Courier is a policy advocacy manager at Transform, and she's leading a lot of our transit advocacy work in the Bay Area, including leading one of our big coalitions. And so she's going to tell you about really what's happening in the Bay Area around the struggles that transit is facing right now. And then Josh is our state policy director, and he is going to talk about what we're doing at the statewide level, again, with our partners to try to address the crisis for transit agencies across the state. So I'm going to turn it over to Hayley first, and then Josh. And welcome to the people who've joined us since we started. So go ahead, Hayley.
Thanks, Edie. Thanks everyone for joining. I think it's we're in a moment, so I'm excited to talk about it, and I'm a little sad to talk about it because transit's in trouble. As Edie mentioned, I helped to lead a coalition called the Voices for Public Transportation Coalition, which is a group of community, equity, policy, environmental, labor folks who were working together to forward a regional transportation measure. But then coronavirus happened, and so much of our state legislation has been narrowed to just essential work. And our coalition is pivoting to focus on the current crisis. So we're really just trying to help transit survive the present moment, not even able to improve it. Though hopefully there can be some improvement in the process. As I think most of you know, transit is about to fall off a financial cliff. I think what is kind of funny or surprising to me is people who aren't in the transit sphere, who aren't paying attention, are like, oh, really? There's a transit crisis? There's so many crises happening right now. It's hard to even keep track, but this is one, of course, that we are deep into and deeply paying attention to. As you may know, transit is largely funded by fares and sales taxes, both of which are very hard hit by the present moment. Ridership is down 70 to 98% on our systems across the Bay Area, 70 being kind of the small local bus service providers, and 98% being like commuter rail, like Caltrain. And we really believe that transit's a public good and a lifeline service, and it needs to be here and functioning now and as we move into a recovery. And I've been thinking about this as we want a just recovery, and public transportation has to be at the center of that. I think what the present moment's also showing us is that this crisis is showing that we have a massive misalignment in our priorities of how we fund public transportation. And we need more diverse funding sources. We obviously relying on fares, kind of this business model of get a lot of ridership, and that's the only thing we can do to fund this public service, as opposed to ensuring that it's funded no matter what, because it's a lifeline service, because it's essential to the operation of our cities, is something we need to be thinking about. So what's been happening, you've probably heard the CARES Act passed in March. There was $25 billion for emergency transit funds in that bill, which is actually win in and of itself. There was $0 in the first draft, so $25 billion is good. Not nearly enough, of course, but the Bay Area got $1.3 billion of that $25 billion, which went to MTC, the Metropolitan Transportation Commission, to distribute to the agencies. So the first 61% was decided by MTC back in April. And then the second 39%, which is about $500 million, is going to be decided on the distribution in July. And the decision is going to, or the distribution is going to be decided by this Blue Ribbon Transit Recovery Task Force, which is something that was created by the MTC to help hypothetically get more voices involved in this transit recovery planning. So, you know, these types of things, these task force type things can be impactful, or they can be a lot of lip service. So we're working to try to make it as impactful and useful as possible. And Transform has a seat on the task force. I'm the representative, and the first meeting is today. But you know, there's some healthy skepticism because there's so much that needs to be done, and there's a lot of players trying to influence that. This task force in particular, the members include MTC commissioners, transit agency GMs, state people like David Chu and Jim Bell, stakeholders like labor and urban habitat and disability advocate and Seamless Bay Area and the Bay Area Council and Transform. And the things that this task force are going to cover are, you know, some of the things that are facing that are key to the crisis of transit right now. One is how to distribute that money that I talked about, the second tranche of the federal money, and then any future money that might come from the federal government. Also, transit agency recovery and restoring ridership, and recommendations for operational changes. But one thing that was notably missing from the first draft of what this task force would cover was worker health and safety. And we know from a like, what could be more important than worker health and safety? We've organized with our allies and partners to push for money actually to be set aside to address health and safety, and in order to see consistent standards for cleanliness and for you know, temperature checks and hand sanitizer on buses and plexiglass and things like that across the region. So, you know, we've been pushing for that at MTC. And they said that they would monitor it. And Dave, this would be a good time to share that graph. So when MTC monitored what the types of health and safety standards that the agency, 27 transit agencies were doing, they found vast differences. As you'll see, this is their own data, which is, you know, what it is. You know, are the percentages there? Yeah. So, you know, many are providing PPE, but only some have barriers, and some have suspended fare collection, but not all of them. Employee health checks are some of them are doing, some are not. And the issue is that this is not consistent. And so how are we going to inspire confidence to build back ridership unless people feel sure that they're going to be safe on transit? We've also seen incidences of drivers asking riders to wear masks or not get on, and then drivers actually responding with violence. And so we're asking drivers to enforce this policy of wearing masks, but not actually providing masks to riders. So there's a lot of issues here, but we're working really hard with a really broad coalition and with our partners at ATU, the union that represents the transit riders, to push for this kind of stuff at MTC. And so we're through our advocacy, we actually ensured that health and safety is now on the agenda and first on the agenda for this Blue Ribbon Task Force. The commissioners kind of went from like, yeah, that's important, to like, yes, we are definitely addressing this. And that's a huge win. And that's the power of advocacy and strong organizing and working with our partners across the region. And I'll just add one more thing, which is that health and safety is essential and must be the first thing. And it's required in order to inspire that ridership to come back. But also, we need a plan for a regional approach to transit that's actually ensuring sufficient service to those who are currently riding transit, and also ensure that this approach evolves as the situation changes. As we know, the situation has been evolving rapidly. There's new information all the time. And so we really need sufficient service to allow for social distancing. We need more buses on crowded lines and more service near hospitals, for example, and like more service when there's a shift change. Service needs to be rerouted and changed to serve transit-dependent riders right now, and not just cut to Sunday service across the board, which isn't serving the present moment. We need a regional approach to make sure riders aren't stranded between systems, because right now the systems don't talk to each other very well. And also that all the different transit modes are available to get people where they need to go and get there safely. So that's kind of what is a little slice or a quick summary of the vast array of issues facing transit right now and some of the work that we're doing to try to address it. And it's also clear, as I mentioned, that the CARES Act funds are nowhere near enough. So we're willing to look to state dollars to help fill some of that gaps, to keep workers employed and keep service running. And that's where Josh comes in.
And before Josh comes in, I want to lift up a question from the chat, and it's from Eleni Jacobson asking, how much transparency can the community expect from that blue ribbon task force that MTC set up? Do we know anything about the frequency of updates from them, or if meeting minutes will be posted or shared, stuff like that? And before you answer, Hayley, I'm also going to put one of our chat prompts in the chat in just a moment, and folks can feel free to just weigh in and answer that question as you have a moment, as you're listening. We also asked if folks want to introduce themselves and maybe say, where you're from, if you are affiliated with an organization, or what your interest is in the topic. People are sharing that in the chat as well. The prompt, and I'll put this in the chat, but the prompt will be, what's inspiring you and giving you hope in the transportation space right now, and where do you have energy to work or to take action? But yeah, back to that question about transparency from the blue ribbon.
Yeah, it's a good question. It is a public meeting, so the agendas are posted online and you are able to access them. There's like a Zoom link and you can access them. I will say public comment comes at the end. So it's basically useless to the conversation, which is a horrible way to set up a democratic process. They do take comments until 5 the night before, and then they send them out to the task force members. Minutes are a good question. I'm not sure, but it's a public meeting in that way. And the list of the representatives are, that's accessible. And so you can access any representative, including me, pretty easily to, involve the process that way. We're also, part of our coalition's work is actually looking to influence the outcomes of this task force and the work and the agenda and the priorities of the task force, which is through, our coalition. We have a core group of about 10, but we have, about 30 or 40 different organizations in our broader coalition that we're working together to talk to commissioners and kind of do our broader advocacy, make a bit of a stink in a show to kind of get our ask met. And I will say I am inspired by all the people who are engaged myself, and I'd love to hear what other people are inspired by, because things are kind of dark. And I am inspired by all the people who are working really hard and like trying to solve a really impossible problem. I feel like transportation was a tangle and a mess before, and now is even more challenging. But people have really good ideas and are being really creative, and thoughtful, and I'm inspired by that.
Thanks, Hayley. Over to you, Josh.
All right. Just to start, my name is Joshua Stark. I'm the State Policy Director here at Transform. I've been, have been around here 8 years, I think, in July. So quite a while, and happy to work in the nonprofit world, and have found an organization where the turnover was actually considerably lower than the industry standard. So that's been really nice, and I feel really well supported throughout this and through my years, because I do operate in a satellite office here in Sacramento. I'm the state guy, so having a presence here in the capital, or I'm just right over the bridge right now from the capital in West Sacramento, I think has been pretty valuable to the organization's goals, especially as we talk about state stuff. So just to dive right in, like Hayley mentioned, this particular crisis is a crisis for transit, right? It's telling people to do things and requiring people to do things that are really the polar opposite of mass transportation. In fact, I believe yesterday the feds came out with some really unfortunate set of recommendations that people switch to solo car travel and not take transit at all, and that they began encouraging businesses to provide benefits and subsidies for solo car travel for employees right now. And meanwhile, we on a state level have been imploring people not to take transit, which sounds really weird, unless it is absolutely vital for their lives or their livelihoods as essential workers. And that's so that we don't jeopardize the lives of those folks who absolutely need transit. At the same time, we recognized pretty quickly that what we needed to do was help transit become robust in a different way. And in a typical year, I've said this over and over, my coworkers are probably sick of it, but in a typical year, when you talk about the effectiveness of transit, we mean efficient. For transit in a normal year, effective is efficient. The more people you move with the fewer amount of resources, the better you're doing, right? The more people you move through a corridor, the better you're doing. Under this scenario, effective does not mean efficient. We actually, for health and safety reasons, but also for reasons of perception for the long run viability of transit over time, once we get out of this, we need to be running very robust, inefficient systems. I mean, to put it very simply, because it's not really rocket science, we need to have far more buses moving far fewer people right now, and doing so in a safe way, in the ways that Hayley mentioned. So at the state level, our recommendations were born out of the fact that year over year, state transit is anemic. It's funded terribly. The state constitution doesn't allow gasoline taxes or diesel excise taxes to be used for transit operations. They can only be used for hard things. They can't even be used for rolling stock for trains. It has to be hard rail in the ground or pavement on the ground. And so that limits some of the funding. And then state funds for transportation in general have been locked away from the general fund. So although that means that during this crisis, there's less of an attitude toward trying to raid transportation dollars, it also means that those road dollars are tied up pretty strong, kept out of reach of a lot of transit operations. But there are hundreds of millions of dollars available in other forms, including vehicle registration fees, for example. So with this variety of options and funding sources available, and also the state manages some federal dollars that pass through, our recommendations were very, very big. What we told the state to do is to temporarily move its investment in large-scale transit projects, to move that money into transit operations. And we also recommended that they move money that's going into new programs from the bill SB1 that was passed a couple of years ago that revamped transportation funding wholesale, to move money from a couple of those pots, including the Solutions for Congested Corridors program, and the, what's it called? I can't remember the name of it, TCEF. It's basically freight corridor, a freight corridor program. And the STIP, which is the State Transportation Improvement Plan, which is basically the last state money for road expansion projects in the state. We asked them to move those dollars that were legally movable into transit operations via the Low Carbon Transit Operations Program that's at the state level as well. So we really came out with a pretty big, bold set of recommendations for a couple of reasons. I mean, one, that's what we really want. We really want them moving large numbers of dollars into transit operations. But two, we wanted them to begin thinking more boldly about the nature of how they're funding transit operations now and in the future. We really think that these moves, although they may be temporary setbacks for large-scale projects, what they would do is instill confidence in the public to use public transportation. So you take a program like the Solutions for Congested Corridors program, that's going to rely on people getting on buses and trains in order for them to meet their goals of reducing congestion in those corridors. And if people have no trust in transit at that point, they're not going to get on, and we're not going to see the numbers. So that's been a yearly problem with ridership declines in many parts of the state just to begin with, and has threatened what's been known as a death spiral, where you have reduced fares, which lead to reduced service over and over again. We're trying to turn that around, but during a time when all of those are magnified to a much greater extent, where ridership has dropped completely off the map, and people don't want to be interacting with drivers, and drivers don't want to be interacting with riders for reasons of safety. So moving towards a fare-free system, transit passes, and those kinds of things. So that kind of moves into our longer-term recommendations, which included that. It included fare-free, moving toward fare-free service, moving toward an integrated transportation plan, which Caltrans is working on and has moved more quickly on. So we're happy to hear that. One last, I guess, little bit of news to drop, which is unfortunate and leads to that diversification statement that Hayley mentioned, was the Greenhouse Gas Reduction Fund dollars came in today, and they are an order of magnitude smaller than we had received in just the previous quarter's funds. And the GGRF is where the state gets its money from capping and putting a price on carbon emissions. And last February, it received $600 million. And of that $600 million, large percentages go continuously to the transit and intercity rail capital and low carbon transit operations, as well as the Affordable Housing and Sustainable Communities program, which also pays for transit and biking and walking. Last February's money was $600 million. Last week's auction result was $25 million. So that pot of money apparently is very volatile. Meanwhile, vehicle registrations have stayed about constant. So there is a way to diversify transportation funding portfolios for future investments in ways that would be more stable and weather these kinds of events. But I don't like to make an annual or even a quarterly comparison without the caveat that this really is a black swan event, right? It is a very, very, very unusual event whose likelihood in any given year was near zero, although over time the likelihood increases. But we're dealing with a whole new set of parameters now, and so we're looking to the state to provide that leadership, that bold leadership that it's done in other ways, whether it's addressing climate or trying to address with stay-at-home orders that came in a little earlier than other states. We would love to see that kind of leadership happen at the state.
Thank you so much, Josh. I wonder if you want to talk a little bit about the Byzantine mess that is transit funding at the state. We have the notorious Chart C, which if people haven't seen it, it's another like laughing, crying, comic relief moment.
Yeah, I'll show you this chart, and we'll just give a quick primer on how transportation funding works. If you could show that chart, I'll fill you all in on how this goes. There you go.
Easy peasy.
Yeah. Clear as mud.
So the state has a seriously arcane, crazy method of allocating funding. In a nutshell, the vast majority of that money ends up being within local control, and it's basically a shell game, because whenever you go talk to the locals, they say, oh, there's state guidelines and parameters that we have to meet. And then you talk to the state and they say, oh, well, it's a local control issue. So for example, I was on a call this morning with Caltrans, and we were talking about the STIP, the State Transportation Improvement Plan. And of course, early on in the conversation, someone has to say, well, 75% of that just passes through to the locals to do with as they see fit. So nobody wants to take responsibility in particular meetings. It's really easy to pass that buck. The problem is, it's not just a buck, right? We're talking about billions and billions of dollars annually. I work with a lot of other environmental organizations here at the state level, and they work, with Department of Conservation issues, or they work with Fish and Wildlife or Parks and Rec. And when I explain to them, like, the fights that are sideline fights, like a fight over $100 million for active transportation last week at the California Transportation Commission, $100 million is some of those folks' entire budget, or substantial portions of their entire budget. We're talking, what would that be? 0.1% of just the state funding annually, and the state isn't even the biggest transportation funder in the state. We're only, the state level only funds also about a fifth, I think, of public transportation. So the amounts of money within transportation in general are staggering, even now, even when they're talking about the dollars just falling off a cliff. The amounts are still, when you compare them to other industries or other agencies, it's unbelievable.
Yeah. We have a hand raised from Sheila Gunn Cushman. You can unmute yourself and ask your question if you like.
Hi there. I would like to give some perspective. I am a transit-dependent rider. I am totally blind. I have other disabilities too. One of them is that I'm a one-handed everything, and because of that disability, I have some balance issues. I can't walk far. I can walk like a couple blocks, but I can't walk the 3/4 of a mile that's assumed. And I'm deeply worried about some of the things that you've already mentioned. But just as in this Zoom call, I can't really read the chats because if I turn on my screen reader to read the chats, then I can't hear the audio of people talking. And it's not easy for me to like pick up stuff out of the chat. I can write in a chat, but I can't really react to one. And so prompts and things like that don't help me. I'm glad you kind of read the one. But just as I do my Zoom differently and I don't turn on my video because I can't see anybody else's, we who ride public transit because we need to be able to do anything, do it differently than commuters do. And I think that the Transform staff knows that, but I don't know who else is on this call and all that. I'm sorry I'm taking so long. But where I'm going with this is, for example, I can't ride Ubers and Lyfts anymore because they put air fresheners in their car that are toxic to me. I get migraines and asthma symptoms from them. And so I can't wear a mask because I have trouble breathing if I do. And so I can't ride transit at all right now. And I'm terrified that I'll be harassed by all sorts of weirdos for not wearing a mask. I'm also very concerned because the way one gets on the bus and off the bus is very different now. I haven't even seen it. I haven't tried it. I don't know if I can do it or not. And I won't know until I'm in it. I have a lot of stress about this. And I don't know if I speak for a lot or a little of the population. But I am a member of the San Francisco chapter of the California Council of the Blind. I'm also with Disability Action Network of Hayward. I've got connections with Senior and Disability Action, though I'm not really a member over there or anything. I mean, I'm always here. I'm a transit advocate. I'm not going anywhere, literally. So yeah, that is my world right now. And as this opens for the rest of the universe, I'm sitting here going, can I get out? Can I get out? Can I get out now, Mommy? Can I get out now?
Thank you so much for sharing, Sheila. I'm really glad you spoke up and raised
And I
your
absolutely
hand.
don't mind if people record my audio. I don't turn on video generally, so it's not anything against the recording or anything like that. It's just the way I roll.
No problem. It's only fair, as you pointed out. And I really want to, thank you for sharing that, because I think it brings into this conversation why we're all here. A big reason why we care about transit is that we know it's a lifeline for so many people. And these cuts and threats have really devastating impact for folks like you, not just folks who are living with disabilities, but I think you're also underscoring how this pandemic is landing much harder on a lot of communities who are already struggling, already vulnerable, and we're already struggling before the pandemic, and it's just exacerbating inequities and injustices that have been here all along. So I'm going to keep you in mind also as we monitor the chat. So folks have been introducing themselves, and we've got a couple people from transit agencies here, the UCSF Transit Service, Transportation Service. We've got a transit rider advocate from Sacramento. We've got a couple of Transform board members and staff members, including who work on safe routes to schools. That's a few of the folks who've introduced themselves so far. And if you like, Sheila, I have your email address, and I can also send you a transcript of the chat if you're curious about it after. But thanks for sharing your experience.
I want to add one thought to what Sheila said, and thank you so much for joining us and sharing that, Sheila. And I think actually Sophia added something similar in the chat, which is that paratransit is always underfunded, ineffective, not serving the needs of people who are dependent on it. And I think that's that's present and part of the problem here with how the CARES Act funding is distributed, with the decisions being made by this Blue Ribbon Task Force. There is one disability advocate who's sitting on the task force, which is not enough because it's not a monolithic community. There's so many different needs across that community. And I think it's just highlighting this is a consistent problem. It's consistently the bottom of the list. And even more now when folks are so dependent on transit, and transit is so underserving that population, we need to be bringing it to the front and center.
Yeah, and there was a question on the chat about how will no contact rules between riders and transit staff affect wheelchair users who need help to safely ride transit. And the last I heard, there were not clear guidance for that. And one of our colleagues who advocates for people with disabilities using transit pointed that out. Hayley, I don't know if you've heard anything more recent, but that's another area where paratransit is lacking.
And similarly to what I was saying about safety standards, is that kind of thing is inconsistent across systems. I think Muni has one approach where, if the wheelchair user doesn't need to be locked in, then the driver, that's fine. But if they do, then the driver needs to call someone to give that wheelchair user a different option, and make sure people on staff. But that's not consistent across agencies. Again, we have 27 agencies. They have vastly different funding opportunities or vastly different impacts because of lost fare revenue and sales taxes. So I think that's another need for consistency, is to ensure wheelchair users and paratransit riders across the whole region have the same access and the same kind of support.
Absolutely. We had another question in the chat. So I think we're sort of going into the discussion portion. Thank you, Hayley and Josh, for setting the stage. We also want to hear from you, either in the chat or please do raise your hand or call on you, and especially thinking about that not everyone can see the chat. It's good to keep our conversation verbal as much as we can. But we did have one question from Drew from the UCSF Transportation Services, which are ramping back up and supporting the UCSF Medical Center's staff, that he's curious about hearing from other transit agency staff about what they're doing to safely ramp back up. And I think we could put that question to other folks as well about what is needed. And I'm going to put our next chat prompt in the chat there, and the the prompt is, what is the prompt? It is, given the crisis, what do you see is needed to help transit weather the pandemic, and what will it take to make transit part of a just green recovery? So it's a big question, but as much as possible, keep thoughts in sort of brief form, but especially if there's anything we haven't talked about today, it'd be great to share ideas, and I can also lift things up for the chat and call on folks. So I'll put that question in there. And yeah, if there's other folks from transit agencies or anything that Hayley and Josh are seeing, best practices for ramping up and safely bringing riders back.
I mean, at the state level, our focus is on ensuring that transit is there when it's time to ramp back up. And, we know that the state is moving to reopen counties. I have told my kids that we're not waiting. We've never been waiting for the government to tell us what to do or what not to do. We are waiting for scientists to tell us when it's safe. So, we know that ramping up contact tracing and testing is going to have to come very robustly. We are just trying to focus on a dramatic increase in dollars available for transit operations, and to then at the bay level, Hayley, if I'm not overstepping my grounds, to be pushing them to do the right thing with those dollars. Unfortunately, some of the recommendations we're seeing are that this implication that transit agencies can fix this on the cheap, and all they need are efficiencies like reduced transparency or not having to meet state climate goals, things like that. And we're hearing that more and more, and we are opposed to those ideas. We think transparency is really important, especially now if you're going to start getting billions of extra dollars from the feds, for example. We should keep an eye on it. It's that perception of trust that goes with that perception of safety that will keep transit viable in the years to come.
I can also share that ATU has a list of asks that they feel like are needed to make transit safe. And that includes some of what I've mentioned, but providing gloves, masks, sanitizer, and PPE for all that are needed, rear door entry and fare elimination, hand sanitizer on all transit vehicles and at transit hubs, state-of-the-art sanitizing to disinfect all transit vehicles at the end of every shift and like between drivers, when drivers switch mid-route. Strategic continuation of service to avoid crowding and limiting passenger loads for different size buses. Ventilation is also something that's been coming up, and trying to figure out how proper ventilation will offer safety. And then fully paid on-site testing for transit workers who might show symptoms, and also health checks for workers with thermometer temperature checks. Also, I'll share that Transit Center has some requests at the federal level. Like, this is a demand in terms of what it takes to open up safely, and having consistent guidelines to look to is something that's happening at the federal level and at agencies across the country, and at the state level, and then at the local level, the regional level that we are working on. And Transit Center has worked with health departments to come up with a list of recommendations on that front as well. So I think there's a lot of people trying to figure it out, and I think there's a lot of unknown, but having good communication and consistency and making sure that these things are met is going to be key to making that safe for those who have to ride it now, and as we're opening up, and who we want to ride it in the future.
And I'm just going to read a comment earlier. There's some good conversation in the chat between Sophia from EBHO and Drew from UCSF. And Drew was just saying for UCSF transportation services, when they board and alight passengers using wheelchairs, their status quo is to kind of treat the wheelchair as an extension of the person's body and avoid contact as much as possible. And it's typically possible to do that, and except for the bus tie down equipment. And they're in the process of installing hand sanitizer dispensers in their buses in case there is any inadvertent contact between passengers or between passengers and drivers. Any other questions? Anybody else want to chime in briefly? We have just a few minutes left, and happy to hear more discussion or answer more questions. There's a question in the chat from Dan. Transit in other countries is operating with mildly reduced ridership and no evidence of transmission. This is Dan Allison from Sacramento. In the US, the view seems to be that major reductions are required and transit is a major source. I believe that means major source of transmission of coronavirus. All anecdotal so far, but how should we be thinking about that issue? And yeah, I'm curious if there are any lessons learned from other countries that people are hearing about as well. And that goes for anybody here, not just Hayley and Josh. Feel free to raise your hand or just unmute yourself if you want to chime in.
I'll share from the Transportation for America and Transit Center have been doing these national calls of advocates who are all working on the same issues across the country in their own local context, and in response to the CDC announcements that best practice is to drive by yourself in your car, and that's going to solve our problem. I think some of the conversation was the transmission rate isn't. There's no evidence that the transmission rate is higher in like a bus than in the community. So if there's a high transmission rate in the community, it will happen on the bus. If there's a low transmission rate in the community, it'll be similar on the bus, assuming we have safe practices, social distancing, good cleaning practices, and all the things that we talked about before. But love to hear if anybody else has thoughts about this. It's a complicated issue. It's not simple.
Oops, I see some raised hands. I was missing Dan. You want to unmute yourself and make your comment if I didn't already do it from the chat?
You already covered it. Thank you.
Cool. And then I have another hand from Sheila. If you want to say something briefly, we have about 5 minutes before we're going to wrap up. Feel free to unmute yourself if you want to say something else.
I just didn't lower it, sorry.
Oh, that was probably my bad. The last thing is, we promised a little bit of personal reflection as well, and I realized we didn't share that before, but Hayley and Josh, do you want to share anything just about how you're getting through this time, or who you're sheltering with, and how it's going, what's getting you through?
Sure. I'll go real quick. My wife and 2 kids and a dog are who I'm sheltering with. And I've been doing a lot of thinking about having to share our private spaces and places on Zoom meetings more regularly, inviting people into our tiny sections of our home. And I also got to thinking about where my own family gets to move around physically, especially here in Sacramento. You know, it was 104 degrees, 105 degrees the last few days. And so this morning I told everybody here that it doesn't matter what meeting I'm in, it doesn't matter what I'm working on, that they have permission to come into the room and do whatever they need. And you know, it's, my kids are a little older, so it's easier. You know, working on respect is not a problem right now. But you know, it started to bother me how restricted my kids' movement has been, just because I need a space to have somebody look at me for a little bit.
Thanks for that, Josh. Anything you want to share, Hayley?
Yeah, I'm sheltering. I guess I'm just mostly grateful that I have a place to shelter and want to acknowledge that not everybody does. I also have a garden. I have outdoor space that is mine. I'm renting it, but it's my outdoor space. It's private space. And I think both of those are a luxury. Having a place to shelter, and I have some roommates and a dog, and having outdoor space where I can, walk around freely and don't have to wear a mask and can easily socially distance is a gift. I also have a great garden that has all sorts of delicious things in it, including hops. And I'm definitely being a stay-at-home, like, hover parent of my garden. It's doing very well, and I'm obsessing over it.
Great. Thanks so much. I'm here in Oakland. I have similar blessings, and including the garden, which helps me a lot. And I've been venturing out for walks on wide trails, with a mask. And I know not everyone is comfortable doing that or able to do that, but being able to get out a little bit into nature has been helping get me through. I see one raised hand from Joaquim, and if you can keep it brief, then I'm just going to wrap us up in just a moment. But go ahead and unmute yourself and add what you like.
Sure. My name is Joaquim Mostus. I'm a engineering consultant, and I'm sheltering here in Novato. And I'm also a member of a couple of advisory committees for the city on bicycle and pedestrian issues. And one of the things that we were looking at was Oakland's experiment or effort in shutting down some of the streets to vehicle traffic, and wanted to see if you guys had any experiences, how that has gone. We're looking to propose similar things here in the city of Novato.
Thanks for asking that. And it's actually a good segue to talk about our future events. Hayley and Josh haven't been working on that in particular, but Transform has been doing some advocacy around that, including just making sure that the slow streets in Oakland are working for all parts of our communities, especially East and West Oakland and Black and Brown communities, and for just all the ways that people use streets. And we help negotiate an update to the policy to also provide safer access to essential places in low-income neighborhoods that are on high injury corridors. So like grocery stores, COVID testing sites, and I think maybe healthcare was one of the other places that could be an essential place. So we're working a lot with the community there to talk about that. And I think that's going to come up in next week's event, which is called Mobility Justice and the Injustice of COVID-19. And that's going to be next Thursday, June 4th at 4:30. We've also got children's story times with Transform on Wednesday mornings in June, just from 9:30 to 10 a.m. We'll be reading stories to kids and to adults, anybody who wants to tune in. And we're definitely going to make those recordings available so that parents can tune in on YouTube for their kids, after the fact, if that time doesn't work for them. We've got the Schools Out trivia contest with our Safe Routes team on Thursday, June 11th at 4:30, and that'll just be a really relaxed, just general trivia. There might be a few transit questions thrown in there, but that should be a fun time. And then we've got another event on June 16th called Public Meetings During the Pandemic and How to Participate, where we'll be talking about all the different ways that public entities are meeting. And If Dave can put the link to the events is there in the chat, and the link to donate is back in the chat as well. So if you didn't have a chance to donate during the show, which we appreciate your attention, please feel free to help support us and support our work. And we do need it and appreciate it all the more during this time. It's a tough time for nonprofits right now, and we just are glad you're with us, and glad you're with us regardless of whether you can donate. We know not everybody can right now. And yeah, just want to thank you all for joining us. We hope to see you at some of those future events, and I think that's it. And we'll
Thank
send
you.
out the chat and the transcript and the recording of the event. So take care, everybody.
Thank you.
Bye-bye.
Mhm.